Hello, we're going to do the instructional video for all of the elective knee exams. There's going to be 4 of them that we're going to do this instructional video for. There is the Camp Coventry, which in clinic they might call the tunnel view. There is the Houston method, and then there is the merchants, which we'll use the merchants board for, and then there's a Setagast view, which the Setagast, the merchants, and the Houston all kind of give a very similar picture, but there are multiple ways to get that same picture, so we're going to show you all the different ways to get the same picture. With that being said, it will be elective, so you will choose between one of these 4 exams. Also, it seems like a lot of exams, however, there's some commonalities between all of the different exams. For example, they are all done tabletop, and they are all done at 70 kVp, and really the big difference between them is putting what angle you're going to put your patient position and what angle you're going to put the tube at. So I'm going to go ahead and start with the Camp Coventry, which, like I said, is also known as the tunnel view in clinic. That's probably how you will hear it referred to. And for this one, I'm going to have Mrs. Marshall, my patient. I'm going to have her lay down on the table, and she's going to be in the prone position on her stomach. We are going to be innovative here and use this trash can as a prop. Typically, you probably would use a tall sponge, but if your clinical site does not have the tall sponge, you may have to improvise, such as using a trash can. So for this, I'm going to have her just rest her foot on the top of this trash can, just like this. I'm going to use a 10 by 12 cassette, and we are going to have the red line or orange line at the bottom towards her foot. I'm going to slide this under her knee, and like I said, this is going to be done tabletop, just like they all will be. They all be tabletop, so there is no detenting the tube for these. I'm going to put a 45-degree angle on my tube, and I'm going to be at 40-inch SID. Okay, and then I'm going to center into the patellar fossa of her knee, which is basically right in the middle of the back of her knee. And what I want is the central ray to come out at the apex of her patella. So you're going to have to scoot the IR down a little bit, and it's going to look like you are positioning this at the very top of the IR, but what's going to happen is when you have this angle on your tube, it's going to project the knee so that it will be actually in the middle of your IR. It's kind of a difficult concept to grasp, but if you follow that angle straight down, it will be right in the middle of your IR, at least it should be. So I'm going to make sure that my central ray lines up to the middle of my IR, those 2 little arrows that are right in the middle. And then I'm just going to center right in the middle of the crease that's in the back of her knee. Now I'm going to collimate in on the side so that I don't have any light on my table. And then I'm going to collimate lengthwise as well, but only the length of the IR. I don't want any light on the table above or below it. And since she's in the prone position, we're doing her left knee. So I'm going to use my left marker, and I have just a little bit of light up here, so I'm going to put my marker right there where I have a little bit of extra light. Now I'm going to make sure that her condyles are parallel with the IR, so that I make sure there is no medial or lateral rotation of her knee that's going to project a rotated knee on the IR. And that is the Camp Coventry. And of course, I would also shield Mrs. Marshall for this. Okay, so I'm going to leave her in this same position for the next one. And we are going to do the Houston method. I'm going to take the trash can. We won't need the trash can for this one. Now, all I'm going to do is change my angle to 40 degrees, and I'm going to go in the opposite direction. So I'm going to go cephalad. And I'm going to move it all the way down here by her foot. Okay, so I'm going to put this 45-degree angle on my tube, and then I'm going to take her foot and just rest it right here on top of the tube. That's a good place for her foot to sit so that it's comfortable for her. You don't want to have her just hanging her foot out there, because she would not be able to hold that for a very long time. So as you can see, this is just like the last one, only we're coming in from the opposite side. So I'm going to make sure, again, that I have my IR positioned, and it's going to be positioned towards, so that her patella is more towards the top of my IR, because when this angle comes across onto the IR, it's actually going to project her knee into the middle of my IR. Now I'm going to center it. You can look and see right where the middle of her knee joint is. That's where I'm going to center this. I'm going to collimate in so I have no light on my table on any angle. And you should be able to see the shadow of her knee on your IR, so that you know that you are getting her knee in the picture. And then I'm going to put my left marker on the space where I have light. I'm going to check to make sure that her leg is completely straight and that her condyles are not rotated either medially or laterally. And then I'm going to shoot this at 70 kVp. I'm going to show you the merchant. So I'm going to have my patient, Mrs. Marshall, she's going to turn over so that she is sitting on the table. Before I have her lay down, I'm going to just show you the merchant board so that you have a chance to see how to use it. This is, let's see real well. I'm going to move you. Okay, so this is the merchant board. It looks like this. So you're going to have a couple different pieces to this. These little arms, thank you. These little arms fold down. That's what's going to hold the patient's legs together in this whole general area so that they don't spread out and then they're not on your film. This raises up and down. On the back of it, there's this little lever. And you're basically it's marked already for you, but you're basically going to put that at the 40-degree angle, which, like I said, there is a label behind here that does say 45 degrees. There's a 45 degree, a 60 degree, and a 30 degree. This way. So you're going to put that at the 40-degree mark, and then that's how you want to have this set up for the merchant. Just like this. Okay, now you're going to put this at the end of your table. Now this table doesn't move up and down, but typically you would raise or lower the table to match the height of your merchant's board. But we got to be a little bit creative because we can't do that. Okay, so then what I do is I bring my tube way out of the way because you don't want to hit your patient in the head with it. Have your patient scoot all the way down to the end of the table, and I instruct them to put both their legs in between these two little bars. Now, what happens is they typically do exactly what Mrs. Marshall's doing, where they don't scoot down far enough. What you have to keep in mind is when your patient lays down on the pillow, it's going to raise everything up a little bit. So I always instruct them to move down just a little bit further. Keep going. Okay. Okay, so then I'm going to have her lay back on this pillow. And if you need them to, just have them grab the sides of the table and scoot down a little further. Perfect. Okay, so I'm going to use a 14 by 17 for this. I'm going to put the red line at the bottom. And you basically just set your IR right on those little bars. It's not the most comfortable position for your patient to be in. And these CR cassettes are not cheap, so you don't want them to move too much and kick that off. So you have to be kind of quick with this one. Now you're going to set your tube at 90 degrees, and then you're going to turn it until you're at the 60-degree angle. And so it's about a 30-degree angle, but you're going caudal. So if you just put the tube at the 60, you'll be at the right angle. Then you basically just drop it down, and we are getting both knees for this. We're doing a bilateral exam. So you're going to center right in the middle between the two patellas. Have the patient kind of bring their knees together. There is a black strap on here where you can strap the patient's knees together. However, I'm not going to torture Mrs. Marshall with that. So I'm just going to instruct her to bring her knees together. Also instruct her to have her feet kind of ankles close together. And you want to be able to see, it looks like two mountains. And you basically want to see the two patellas right next to each other, side by side. You'll be able to see the shadow on the IR. And then typically when I do this, I always mark both sides. You at least need to mark one side. And then I collimate down. You really don't need a whole lot on your IR, so you can collimate in pretty close to the top of the patellas and pretty close into the sides, because all we're looking for is that patellofemoral joint. And then I would set my KVP at 70, expose. Okay, and then before you instruct your patient to do anything, move the tube out of the way so they do not hit their head on it. Thank you. And move the IR so when they sit up, they do not break it because it falls onto the floor. You can go ahead and sit up. Okay, that is the merchant. And we have one more. I'm going to move my tube so that Miss Marshall does not hit her head. And then go ahead and scoot back here to the middle of the table for me. I'm going to move my merchant forward. Okay, this last one is the Setagast view. And we're going to use a 10 by 12 for this one. We are only looking at just the affected knee. I'm going to give this to Mrs. Marshall. I'm going to have her put her affected knee up. And we're going to do the right knee for this one. And basically, she's just going to hold this for me, and she's going to rest the IR on her knee. I'm going to put my tube at a 15 to 20 degree angle. And it's going to be cephalad towards her head. Now, you're going to have to come, because of this room, you're going to have to come to off the edge of the table in order to get the angle correct. So just keep that in mind. You might have to have your patient scoot down towards the end of the table. This angle is not right. Okay, so I'm going to check my SID and make sure that I'm at 40. And I'm going to ask my patient to hold that right there for me while I make sure that I get the correct SID. Thank you. Okay, now I don't know how well you can see this, but you should be able to again see her patella in profile here. You should be able to, it kind of looks like a mountain. You should be able to, yeah, let me try and see if, there we go. Ah. So you should be able to see her patella in profile here. You're only getting an image of that, so you can collimate down pretty close. Okay, now I'm going to center just right at the apex of her patella. So I'm going to center at the bottom of her patella. And that's going to put her entire patella in profile here. I'm going to collimate down very closely. And then I'm going to put my right marker on the lateral side, because I am imaging her right knee. And I'm going to set my technique at 70 kVp. And those are the 4 elective positions that you are going to be doing for your knee exam.